Good morning to all those who are preparing for the FRCS Urology Viva exam. Today, I will be uploading a video on a commonly asked scenario of in pediatric urology, which is nocturnal enuresis. Remember that on this table of pediatric urology, you get asked two scenarios. I have started this YouTube channel of preparation for FRCS urology exam because lots of candidates have approached me and inquired as to how to go about it. It is really difficult and time consuming to answer all one by one. Therefore, I planned on making this YouTube channel so everyone can get maximum benefit out of it. Coming back to the pediatric urology table, now many candidates find this table relatively difficult as compared to the others. So let's start with a scenario on nocturnal enuresis. Remember, I have not taken the question from any book, I have made them up myself, and these are the type of questions you are asked in the section 2 of the exam. Now, let's start with the scenario. A mother has brought her child to your clinic complaining of her son's nighttime bed wetting. Now, before answering, just remember a few points. While answering a question, keep in mind that you have to answer like a day one consultant. Don't answer like a final year medical student and keep on saying, I will ask and I will ask and I will ask. It gets monotonous, boring. Keep it short, precise, crisp, and the way I will answer these questions is as follows. So, a mother has brought her child to your clinic complaining of her son's nighttime bedwetting. What are the important questions you would like to know from mother in assessing a child with enuresis? I would like to know about the age of the child, whether it is primary or secondary, continuous or intermittent, and at what particular time the child wets. Is it only at night or does it occur during daytime as well? Are there any associated low urinary tract symptoms, risk factors like UTI, constipation, family history, or any other neurological condition? The next question the examiner would then ask would be, what are the key points in examination? Well, I would do a chaperoned examination in the presence of mother and would check the general well-being of child and will do an abdominal examination to rule out a palpable bladder and a chaperoned genitalia examination to rule out meatal stenosis and epispadias. Further, I will inspect the back for any hairy patch or flat buttocks and would complete my examination by looking for wasting of calves muscles and an abnormal gait. Then the examiner would ask you, how would you investigate him? Well, I would ask the parents to fill a bladder diary and would send urine dipstick to rule out a UTI and request for an ultrasound scan of the kidneys and bladder, looking for duplex kidney, which may indicate the presence of an ectopic ureter. And in the bladder, especially, I would look for a thick walled bladder and post void residual, and would further look for a Euroflow study or ask for a Euroflow study to look for the Qmax, flow pattern, and post void residual. So the examiner then asks you, the child is male, is 6 years old, who only has bedtime wetting at night with no daytime urinary symptoms. So what is this likely to be? This is a monosymptomatic nocturnal enuresis. Can you define nocturnal enuresis or bedwetting? Well, it is defined as symptom of involuntary intermittent leakage of urine during sleep. The next question they ask is, are you aware of any types of nocturnal enuresis or can you classify the nocturnal enuresis? Yes, there is a monosymptomatic nocturnal enuresis in which which is actually a nocturnal enuresis without any lower urinary tract symptoms. Then there is non-monosymptomatic nocturnal enuresis, that is nocturnal enuresis with associated voiding dysfunction. A primary nocturnal enuresis in which the children have never been dry for more than 6 months. Secondary nocturnal enuresis refers to the bedwetting which recurs after a period of being dry for at least 6 months. Now, the mother is worried about a child and wants to know if it is a common thing. So I will generally I will reassure the mother that prevalence of bedwetting actually decreases with age, and it affects 15% of the children up to the age of 5 years, which is reduced to 5% at 10 years, and further goes down to 1 to 2% at the age of 16 years. She's still not convinced and wants to know why her son has this problem while her elder daughter, who is 8 years old, never had this complaint. Alternatively, the examiner can simply ask you what is the cause of monosymptomatic nocturnal enuresis. So I would answer it this way. Basically, it may be caused by lack of arousal from sleep, a decreased secretion of ADH or an antidiuretic hormone at night, which in turn results in increased production of urine. There is a reduced or because of a reduced nocturnal functional bladder capacity with or without nocturnal detrusor overactivity. There are other causes which are implicated, like family history in 75% of the cases, psychological factors, UTI, and constipation. But the main are the ones which I mentioned earlier. So, what is the usual age of bladder control in children? Generally, children become dry by the age of 5 years. And how will you manage this child initially if he had primary monosymptomatic nocturnal enuresis? In this child, I will reassure and counsel the parents that they should not punish the child for bedwetting. Rather, they should try to improve the child's self esteem by reward systems. Would further advise on bladder training and ensure that the child drinks and voids regularly during the day and should reduce their fluid intake during evening before sleeping. Child should pass urine before he sleeps, and parents should be advised about lifting the child during night. Also, avoid constipation. Now, despite the behavioral modifications, the child has not responded and is still bedwetting. Are you aware of any other treatment options? Yes, an enuresis alarm can be used at this point. What is it? What is an enuresis alarm? Is it effective? Well, an enuresis alarm is connected to child's underwear and it is activated with the first few drops of urine, hence waking the child from sleep. It is successful in about 60 to 70% of the cases. What if the alarm fails to produce a response? Are you aware of any medical treatment which you can offer this child? Yes, I can offer Desmopressin in the form of either Desmotab or Desmomelt. What is Desmopressin? Its dosage, its efficacy. Can you tell me something about that? Well, Desmopressin is a synthetic analog of ADH and it produces an antidiuretic response causing decreased urine production at night. As far as its dosage is concerned, Desmotab is the dose in children is 200 to 400 micrograms and the Desmomelt dosage in children is 120 to 240 microgram. Starting at the lower dose of 200 or 120 microgram and then increasing to higher dose if the child is not completely dry. It is effective in up to 70% of the patients. Now, what do you need to particularly advise the parents when prescribing Desmopressin? I will advise that it should be taken at bedtime with fluid restriction 1 hour before taking Desmopressin and until 8 hours after taking the medicine. Any other pharmacotherapy you can offer the child whose bedwetting has not responded to alarm and Desmopressin? Yes, I can consider anticholinergic as oxybutynin combined with Desmopressin for children who also have daytime symptoms. This is to be given by a healthcare professional who has expertise in managing the bedwetting. I'm aware of this. So, can you offer a tricyclic antidepressant to a child with bedwetting if all above fails to improve his symptoms? Well, imipramine as a tricyclic antidepressant can be prescribed at this stage, but it should never be used along with Desmopressin or anticholinergic. Which patients have a bad outlook? Well, those who have asthma, are obese, were born premature, or who have attention deficit hyperactivity disorder. Now, this is the type of scenario which you are asked in the exam and which is for 10 minutes. And I would appreciate it if you can please subscribe to the channel, and I will upload more videos, and hope this video helped you all. Thank you very much.